All right, welcome back to ABA exam review and the continuation of our RBT practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shoutout. Work hard, study hard. Let's get going. A client who normally receives a cookie every time they yell cookie begins a new plan where the technician only gives cookies when the client calmly requests a cookie. On the first day, the client yells cookie louder, throws toys, and bangs the table when no cookie appears. The next day, yelling increases before it starts to drop off by the end of the week. What does this sudden increase in yelling and new problem behaviors illustrate? So let's think about what the question is focused on. It's focused on the increase in yelling and problem behaviors. Now, when can we say that increase started? Well, the client normally got a cookie when they would yell cookie, but now the technician has put that on extinction. How do we know it's on extinction? Well, the client is no longer receiving reinforcement for yelling cookie. Extinction, withholding reinforcement for a previously reinforced behavior. So if we were to graph that, it may look something like this, where we have the yelling for the cookie, and then extinction starts, and what has happened? That behavior rises. But it starts to drop off by the end of the week. So it's gotten worse, and then it goes down, 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 down. And that's what we expect with extinction. And what do we call that expectation of this little peak and then the decrease? A, negative reinforcement. Well, we're not using negative reinforcement here, right? We're using extinction. So make sure we identify the correct consequence. B, extinction. We are using extinction, but the question is looking at the increase in yelling and new problem behaviors, not necessarily the intervention. So what the increase in yelling would be considered is C, extinction burst. It's that temporary increase followed by the decrease. And then D, positive punishment. Again, let's choose our right consequence. We're not using negative reinforcement, right? We're not using positive punishment. We're using extinction, which is leading to this extinction burst and that increase in yelling and new problem behaviors. A behavior technician is conducting a preference assessment with their client. The technician is following the client around the ABA clinic, observing what the client chooses to play with, and records how long the client plays with the item. What best describes this type of assessment? So we're looking at the type of assessment we're doing. And right off the bat, the question says it's a preference assessment. Now, is a preference assessment the same as a reinforcer assessment? It's not. A preference assessment is identifying what the client may like and what potentially serves as reinforcement. A reinforcer assessment is actually assessing the stimuli for reinforcing properties. And we're not doing that here. We are doing a preference assessment. So now we have to ask ourselves, well, what type? And the quickest way to determine the type of preference assessment is ask yourself how many items are being assessed. If we're looking at, let's say, a forced choice or paired choice, that's going to be 2 items. A multiple stimulus with or without replacement is going to be 3 plus in a systematic manner. Here, we've got a technician who's just following the client around, observing the client, letting them choose what they're going to play with, not systematically introducing things, not forcing anything on the client. And so when we get to this child-led type of assessment or intervention, that is going to be considered a free operant assessment. So the technician is conducting this free operant assessment with their client to determine preference. During table time instruction, Lynn presents a flashcard with the letter A and says point to A. The client touches A and receives praise and a small edible. After a 5-second pause, Lynn presents the next flashcard. The session continues like this for 10 minutes. Which teaching procedure is being implemented? So when we think about teaching procedures, think about your 2 primary ones, which would be discrete trial and incidental or naturalistic teaching. Think of those as kind of the umbrellas where DTT lives here and then naturalistic lives here, because we're going to typically teach a new behavior with DTT. And then once it's learned, we'll go to naturalistic teaching to help maintenance and generalization and that sort of thing. Now, in this case, Lynn is doing what? Well, she's following these basic steps of DTT. Present a flashcard with the letter A, so we have our SD. It looks like she then prompts the client. The client then responds, and then the consequence is delivered, followed by a pause, and then what happens? We repeat to the beginning. And that is your just basic DTT order of operations. With an incidental teaching method, or NET or naturalistic, we're not arranging it like that, right? We're using the natural environment to take opportunity to teach certain skills. It's not a task analysis, because remember, a task analysis is the process of creating a task chain, where task chaining is what we're teaching. And then free operant training, just like with our preference assessment, free operant is much more child-led. In this case, Lynn is controlling everything. It's very systematic. It's very, very controlled. And so she's using this standard order of operations. So the teaching procedure here is A, discrete trial training. The client's family gives Tony, a behavior technician, an expensive sports jersey at the end of a session as a thank you. The family insists it is just a gift to show appreciation for hard work. What should Tony do? All right, so the rules on gifts are more relaxed now. It used to be a strict no gift policy. Now we can do what? Well, we can accept a gift that's under $10. So it needs to be less than $10, and it can't be routine. In Tony's case, the jersey is expensive. We don't know how expensive. End of a session, and it seems like a one-time thing because the family insists it's just a gift to show appreciation for hard work. Knowing what we know, what should Tony do? A, refuse the gift no matter what. Well, he doesn't have to, right? It just depends, again, on the cost and how frequent it occurs. We want it to be a very infrequent, non-normal thing, and we're only spending $10 or less. B, accept the gift regardless of price if it is not a routine thing. Well, if the jersey is $100, Tony can't accept it. That is too expensive based on the ethical code. C, the gift must be non-routine and under $10 for Tony to accept it. Yes, these are our two most important things. Non-routine, under $10. Perfect. D, take the gift, but then immediately get rid of it after session. D is not a good choice. You might be thinking you're doing the right thing. It's just a little white lie, but you're setting the wrong expectations. If they are giving these very expensive gifts, you need to talk to your supervisor about it, and a plan needs to be developed to explain to the client's family why our ethical code prevents this type of behavior. Tony, what should he do? The gift must be non-routine and under $10 for Tony to accept it. A client learns to say dog whenever they see the family's brown Labrador. The next day at the park, they point to a stranger's black poodle and say dog without prompting. What best describes what is happening? All right, so let's look at this situation. We have a client who says dog when they see the brown lab. Okay, so the lab dog, right? Stimulus response. Next day at the park, client sees poodle and say dog, right? Or I should really be stimulus same response, right? So both stimuli are evoking the same response. Now, what do we consider that? A, stimulus discrimination because the child can tell the family dog from other dogs. The child is not discriminating between stimuli here. He's calling the brown lab dog, calling the black poodle dog. And what the client is saying, there is no difference in the dogs. B, stimulus generalization because the child uses a dog for different dogs they have not seen before. Yes, the child is generalizing his response across stimuli. That's stimulus generalization. With response generalization, we've got a single stimulus with multiple responses. And since dog is the only response with multiple stimuli, it's just the opposite. And then D, maintenance. Well, since the black poodle was a stranger's dog and the kid was never necessarily taught to point to a stranger's black poodle and say dog, Maintenance doesn't fit as well as generalization because maintenance has to do with being taught something, the teaching being over, and the skill continuing. So what best describes what is happening? Stimulus, generalization. Thanks for watching. Check out btexamreview.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.